Okay, you'll be doing module 1, and you'll be doing 2 views, routine views of the chest, which is the PA view and the lateral view. Right now I'll demonstrate the PA view of the chest. My patient is changing currently, and prior to the patient entering the room, I'm getting the room ready. I'll clean the room. Okay, I'm ensuring that the erect bucky is clean. Alright, and I'm getting all my accessories ready. So I have my anatomical marker that I'll be using, placing on the image receptor. I have my X-ray tube set up and aligned to the erect bucky. Okay, so I'm ensuring that's done. And I have an SID, or source image distance, of 183 or 180 centimeters or 72 inches. That's been set already. So my room is ready. I have my CR cassette in the erect bucky right there. It's a 35 by 43 centimeter cassette size, and that's placed vertically at the moment, okay, or lengthwise. So now I'll call my patient in. Hello, Mr. Spence. Come on in.
Thank you.
Okay, so we'll be taking a chest x-ray on Mr. Spence today. I'll be doing 2 views on you, but I'll start with one view where you'll be putting your chest against the board. Before we begin, I need to give you a lead apron, so I'll do that. Okay, shield your patient to ensure that they're protected from the radiation. So this will go around your waist. Okay, just relax for a moment. Okay, so when you're positioning your patient, you start off with a lead apron, because you don't want to put that on the end. You will have to reposition your patient. This is a PA view of the chest, so which means the X-ray beam enters posteriorly and exits anteriorly. The patient's anterior wall of the chest is against the erect bucky. Okay. Usually you would put the image receptor about 5 centimeters above the upper border of the shoulder, or 2 inches above the shoulder. So I'm going to bring that down just slightly. Okay. And that looks like it's about 5 centimeters. That's good. I'm going to make sure I'm aligned to the image receptor. Central ray is perpendicular and centered to the image receptor. I'll close that. I'm using my anatomical marker, placing that on the right side of the patient. Okay, so to ensure my patient is nice and straight, the coronal plane has to be parallel to the image receptor, the mid-sagittal plane perpendicular. Patient has to be nice and straight, not leaning forward or backwards. Okay, arms are either around the board or placed on the hips with the shoulders pushed forward towards the image receptor. The crosshair central light, the centering point, has to be at the level of T7, 7th thoracic vertebrae. Make sure the patient is nicely centered. And take the X-ray on the second inspiration. So rehearse the breathing instructions with the patient. Ask the patient to breathe in, breathe out, breathe in, and then on the second big breath, expose your film. So that's it. Mr. Spence, can you take a deep breath in for me? Breathe out, breathe in again, hold your breath, and I'll expose the film. And that's it for the PA view of the chest.